Growing international concern this hour over a new coronavirus variant that scientists say could be more infectious than previous strains. The World Health Organization has assigned it the Greek letter Omicron and labeled it as the fifth variant of concern. Omicron was first detected by researchers in South Africa, and many countries are now imposing travel bans to stop its spread.
There's a dreadful feeling we've been here before, as the last flights from southern Africa arrive at airports in London and Paris on Friday. The EU agreed on the need to temporarily halt travel to the region after Commission President Ursula von der Leyen called for unity from the bloc.
We're taking the news about the new highly mutated COVID-19 variant very seriously. We do know that mutations could lead to the emergence and spread of even more concerning variants of the virus that could spread worldwide within a few months. It is now important that all of us in Europe act very swiftly, decisively and united.
But the World Health Organization has warned against countries hastily imposing travel restrictions on South Africa and neighboring countries.
WHO recommends that countries continue to apply a risk-based and a scientific approach when implementing travel measures, in accordance with the temporary recommendations of the 9th Emergency Committee.
The first case of the new COVID-19 variant in Europe has been found in Belgium, with confirmed cases in Hong Kong, Botswana and Israel. The Omicron variant, named after the Greek letter, was first detected in Gauteng, South Africa's most populous province, and it's feared it could be more transmissible and vaccine-resistant. The impact of travel restrictions on an already struggling economy are also a concern for locals.
It's bad because we suffer for 3 years without business, and now the variant is going to kill us. How can we survive?
So the cancellation of flights is going to affect us big time because there will be no tourism at all, and our business really lies on tourism.
As passengers rush to leave South Africa, experts are warning that the new variant will almost certainly reach more countries.
DW correspondent Adrian Krisch is in South Africa and sent us this reaction from Cape Town.
The past few weeks here in Cape Town almost felt too good to be true. With low infection rates, life slowly got back to normal. For the first time since the beginning of the pandemic, tourists from around the world filled up the city once again. Now the new variant was discovered, and it brings back a déjà vu of sorts to what has happened about 1 year ago. Back then, South African scientists discovered the beta variant here. And while the detection here does not mean that it originated from South Africa, same case for the current variant, by the way, it had devastating impacts on the economy of the country. There were lots of travel restrictions imposed on South Africans who were not allowed to travel to many countries abroad, but this also reduced the number of tourist arrivals here in South Africa, a scenario that we are likely to see again now. At a time when summer, the major tourist season, has just started, that would have brought much needed boost to the tourism industry. The pandemic has made the massive unemployment and poverty crisis in South Africa even worse, and once again, no end in sight.
Let's bring in Wolfgang Preiser. He's the head of the Division of Medical Virology at Stellenbosch University, and he joins me from Cape Town. Mr. Preiser, welcome to the program. The WHO is now calling this variant one of concern. What does that mean exactly?
It means that it has properties that are of concern, and that could be that either it can evade the immune response, it can infect vaccinated individuals, or it causes more severe disease, or it is more easily transmissible, or any combination of the above. And unfortunately, WHO has come to the right conclusion. This variant, at least from the genetic properties that it has, looks as if it could do a few of those tricks. So it's something we really need to worry about, and something we need to investigate very quickly.
You mentioned vaccines and the potential that this variant has to evade the vaccines we now have, this life-saving medicine. Vaccine inequality across the globe, this is a real issue. Would we be in this situation if wealthier nations had done a better job of sharing this life-saving medicine?
I speak under correction because there are many aspects of this new variant that we don't know yet. For example, where it originated. We found it here in South Africa. It was also found in neighboring Botswana and then in travelers that had come back from South Africa. So we think it may have arisen in the South African region. We don't know exactly where. I'm saying that because South Africa is in a unique situation among African nations of actually having currently enough vaccines for the eligible population. The problem that we are facing is vaccine hesitancy. It's very much like the industrialized countries where there's more vaccine than there are willing takers. Other African countries, of course, are not in the same fortunate position. They do not have enough vaccine. So I'm not diminishing that argument at all. But should that variant have arisen here in South Africa, it could not be blamed on not having enough vaccine. It would rather have to be blamed on the vaccination program, population hesitancy, and resistance to vaccination.
Mr. Preiser, it was South African researchers who detected it, and they sounded the alarm very quickly to the rest of the world. And some countries now have placed a travel ban on that part of the world. Is that the right decision? Do travel bans actually work?
Well, yes and no. I must say I have sympathy with these decisions. It seems like the obvious thing. You don't want this to be introduced to your own country, so you prevent people from entering. And if they do enter, then they have to go and quarantine and so on. In the long run, it won't keep it at bay. So I think it's an immediate measure. I just wish that South Africa is not once again, like already last year when we also identified the Beta variant, is not sort of punished, if you want, by being placed under travel restrictions long after the actual risk has waned. So my expectation is that this time around, these travel bans and other measures will be revisited quickly and regularly as new evidence emerges. And we are busy working on that. We have the virus in the lab. We are setting up epidemiological studies. And I think that within weeks from now, we will know a lot more about it and can decide just how concerning it really is. Is it such a problem as we fear it might be? Or maybe, after all, it is not quite as bad. So let us hope for the latter, and let us hope that if it doesn't turn out to be quite as bad as people may fear, that then also these restrictions are lifted. And I think the ultimate message, of course, must remain that our best bet to get out of this pandemic situation is universal vaccination. So we cannot really be safe until everyone on Earth is vaccinated and thereby protected against at least severe disease and death.
Because this virus doesn't see borders. Virologist Wolfgang Preiser at Stellenbosch University, thank you very much for your time. We're going to stick with the story and bring in Stephen Beardsley, who's with DW Business. He joins me now in studio. Stephen, let's talk about the financial world. How is it reacting to the news of this new variant?
Well, Abby, we're seeing a lot of sell-offs right now from global markets. Wall Street, for example, the biggest capital markets out there, we're seeing 2% losses from each of the major indexes, Dow Jones, S&P 500. That's pretty big. What we're seeing is a lot of deja vu from the first days of the pandemic around 2 years ago, where investors, they don't have a clear view on things than we do, but they feel like they know where things could go. And we're seeing it with the travel restrictions and with the possibility of lockdowns. And what that means is that if there's less travel, then there's less need for, say, oil, for example. Oil prices are falling. Lockdowns would also pull back on travel. We're also seeing that that shares in companies that, for example, are researching medicines, that are researching vaccines, those are rising. And we're seeing investors try and move their money into safer places. They're moving into things like U.S. Treasuries and out of cryptocurrencies. So we're seeing a lot of movements of investors trying to get their money into a safer place because they're saying, in the worst case scenario, this could look like it did 2 years ago. It's important to remember here that many businesses have not fully recovered from the first wave. We're just degunking supply chains still. They're not there yet. And so this could further throw that into issue. Many companies are still looking for workers. Consumer behavior has changed over the last few years. So there's a lot of complication when you look at where businesses stand as they just start to imagine the possibility of a new another round of the pandemic.
Certainly, economies around the globe have been hard hit. As you mentioned, some are still struggling to recover. What kind of further setback could this new variant now potentially have?
I mean, it could be pretty substantial because we haven't seen economies fully recover. We've seen that 2022, 2023, many economies were supposed to come closer in that direction. It depends on whether they were advanced economies like Germany, like the United States. Developing economies, for example, in Africa, they were going to need longer. This could set them back even further. You know, in the meantime, to get there, many countries have taken on a lot of debt. And while countries like Germany and the US can afford that debt, people will buy it. In Africa, they can't afford it. And also elsewhere here in the EU, if you look at the debt loads on Italy, for example, this could put new strains on many countries as they try and bridge that gap to the end of the pandemic, wherever that is or whatever that is. You know, what we're also going to see here is some fundamental questions about globalization and the ideas behind it, if this is as bad as many people are making it out to be. That means the idea that countries really rely on each other to follow their strengths, to trade with one another, and to not create redundancies in the system. But if everyone says, we're going to have to close borders down, we can't rely on supply chains working, then there are big issues about what we're going to do in the future. There's also the issue of inequality, and that's going to be a growing concern as well. Many African nations, again, many lower income nations, we realize that the black economy is really important for these workers. That tends to suffer first when things like tourism fall, and tourism hasn't returned to many of these countries. Look at Bali, look at South Africa. They're still waiting on those people to return. And so if many of the workers who serve them in that economy, if they're not able to come back, then that means less wages for them. That means less economic well-being. So in the end, this is all about jobs and livelihoods, including what we're seeing with Wall Street. That's really what it comes down to, is these companies, their ability to stay on their feet and provide jobs and livelihoods for people.
DW Business's Stephen Beardsley. Thanks for walking us through that, Stephen.